It's time to take 5. Now you know.
So much needs to be done to battle the opioid crisis. One solution is to remove pills from the treatment process for many types of neck and back pain. Using methods such as interventional pain management gets to the root of the problem instead of just masking the symptoms with medication. With us today is Dr. Alejandro Tapia from Physician Partners of America. Welcome, Dr. Tapia.
Thank you for having me.
Can you explain what interventional pain management is?
Yes, it's treatments and procedures that we do to get to the root cause of the pain without relying on opioids.
What are some of the newest developments?
Some of the newest developments that we have are laser techniques to treat pain. We can use those to treat arthritic conditions in the lumbar spine via the laser, and gives us a very nice prolonged pain relief for years.
Now, I understand you have the ability now with a new doctor from Tampa that's able to do the surgeries right here in Palm Beach County?
Correct. We have Dr. St. Louis, who is a laser spine surgeon that we use when interventional pain techniques either don't provide prolonged or sufficient analgesic relief to the patient and they are deemed a surgical candidate. He can come in and evaluate them and see if they're candidates for laser spine surgery.
Now, I understand this is minimally invasive. What's the difference in incisions versus open back surgery?
Correct. Usually incisions in laser spine are about 1 inch compared to about 4 or 5 inches for traditional spine. The recuperation is significantly less. It's all done in an outpatient surgery center, so the patient goes home same day. Recuperation is usually a couple of days.
And what kind of conditions can you treat with a laser spine surgery?
We can treat anywhere from spinal stenosis to radiculopathies to arthritic conditions, degenerative disc disease.
After the procedure, is physical therapy required?
It is not required, but generally it's recommended because a combination of the two will prolong and help the patient recuperate much faster.
And are there any kind of restrictions like lifting, physical activity?
No more than the normal after any surgical procedure, but the patient generally will go back to their normal activities of daily living in a short period of time.
What are some of the biggest concerns you've heard from your patients?
Generally that is the recuperation time and the trauma from the surgery, the incision sites, and the pain afterwards. And we generally tell them since it's a much less invasive procedure, their pain is a lot less. Some patients even wake up from the procedure already pain-free.
So can you also share some success stories from some of your patients who have gone through this laser spine surgery?
Sure. There's one patient who for years hadn't been able to golf, and he had the procedure done, and within a week he was in the golf course back playing 3 times a week.
One of the procedures you perform is a spinal cord stimulator implant that I hear shows a lot of promise for your toughest pain cases. Can you explain how that works?
Yes. Spinal cord stimulator is an implanted device that uses electricity to interrupt the pain signals from reaching the brain, which is where we process all our painful stimulation. So we take a spinal cord stimulator, we have a small lead that under fluoroscopic guidance, which is a live x-ray, is placed in the epidural space, connected to the generator, which is the battery, and that will then provide the power to go ahead and interrupt the pain signals from reaching the brain. And this is about the size of the battery. As you can see, it's very small. And we place that right under the skin, collect the wires, and the wires go into the spine.
Can you share some of the success stories from your patients who have undergone the spinal cord stimulator implant?
Sure. I had one patient that she presented to me. She had spinal fusion surgery, was using a walker, hunched over was the only way she could walk around. The day of the spinal cord stimulation, we put it in. She walked out of the surgery center upright without her walker.
That's incredible.
Yes, she was very happy, and we've begun titrating her off her medication.
Thank you so much, Dr. Tapia. To manage your pain without the use of opioids, call Physician Partners of America now for a same-day appointment in Wellington or Boynton Beach. Their number is 855-208-PAIN, or you can visit them online at ppoamedical.com.